Welcome back, our viewers. Continuing at your show, Flex Well, away from the gym, now with our Dr. Alsarraf in the nutrition segments. As a dietitian, he is helping us with a lots of questions, giving us these answers in regards of nutrition. So welcome back, Doctor, and we're so glad to have you with us.
Thank you.
So, Doctor, for today's topic, we would like to discuss about the heart health and how can we stay healthy and do these healthy habits for the heart, because sometimes we do some unhealthy so we eat some unhealthy food or we do some unhealthy habits that will affect our heart. So can we start with that and we have a general idea about it?
Sure. Overall, there are many, as you said, lifestyle, say, habits in which if we do it, we increase the likelihood of having heart disease.
Yeah.
Such as you said, unhealthy eating habits, overall lack of physical activity, simply not being active enough during the day, and also sometimes people who are actually smoking cigarettes does play a role in increasing the risk for having heart disease.
So smoking cigarettes is actually one of the worst things that anyone can do for themselves and for the people around them sitting near to them.
Yes.
I don't smoke cigarettes and I wish that no one would, because it is one of the worst things. This is just a little advice that we need to remind our viewers about it. If you have anyone that's close to you, addicted to it, try to advise them, try to give them this healthy advice for them. And of course, the doctor, continuing at our topic, to have the lack of physical activity, unhealthy habits. So the healthy habit is to do an exercise. How recommended it is for an exercise or for a cardiovascular workout for the heart?
Overall, the recommendation is to aim for 150 minutes of exercise during a week. This does help in like reducing not just heart disease but many other diseases. Overall, so people can cover this up by having simply 30 minutes of exercise 5 days a week, or 50 minutes of exercise 3 days a week.
3 days a week. Yeah. It is good, as we heard. But when you said 150, I thought, okay, a day it's a lot. But okay.
Yeah, people think that we need to move really a lot, but it's really just that simple. Alongside, of course, you need to be active during your day.
Yeah, of course. And for those who go to the gym, we tend to work out for like 40 minutes and do a workout like a cardio exercise for like 30 minutes. So we cover up already.
Yeah.
But for those who are sitting at their home thinking that just eating healthy food, it's not specifically the perfect thing, because we need to exercise. We need to have something in the morning. Will be perfect. Even in summer, it's not that hot. Yeah. So continuing at it. So doctor, what are the most forbidden food that anyone should eat, because it will be unhealthy for their heart?
All right. Overall, there is a good plan. Actually, two plans. Overall, there is the Mediterranean diet. It's found that if you follow a Mediterranean diet, you have a lower risk for heart disease.
Yeah.
Alongside, also, there is the called DASH diet. It stands for Dietary Approach to Stop Hypertension. Because as we know that hypertension does lead to heart diseases.
Yeah.
So overall, the DASH diet have some principles in which overall you need to lessen the amount of fat and increase the amount of fiber.
Mm-hmm. And it is really important to focus at both. And of course, even blood pressure is actually one of the most important things. Heart health or heart health is actually one of the most important things for every person. It is the engine of your body. Okay, so to keep it working in the best efficiency is actually one of the most important things. So, is there any, like, let's say for a lot of people, they tend to think that eating less carb but eating more fat with eating more protein and unhealthy fat, unfortunately, they think it's good for the heart. Is it connected?
Unfortunately, no. Actually, the recommendation is to limit specifically the saturated fat, which is mostly coming if you deep fried or cooking simply your food with oil, whether it was protein or even carbs.
Fried chicken without carb, is it healthy?
Fried chicken,
deep fried chicken
with the coating of because coating is still considered carb.
Yeah, no, they think it's not that.
So
carb.
it's not actually a recommended choice. You can have an alternative whereby you have like a chicken seasoned and then covered with like whole wheat dough or flour.
Or cereal, maybe?
It depends on type of cereal. I know that's a trendy option.
Yeah, we tend to do it.
But then it's always good to air baked or simply put it in the oven.
Yeah.
It will be a way healthier option.
Yeah. Okay. So these are really important, but we have more and more important questions because heart health is, as I said few times, and I'm gonna keep saying it, one of the most important thing. We're gonna keep continuing on this question, Dr. Alsarraf, and then we will be back. Thank you so much, and thank you all the viewers for watching. That's not the end. Do not go anywhere because we'll be back after this break. And welcome back, our viewers, continuing after the short break with our Dr. Alsarraf. So welcome back, doctor, and continuing at our topic was the heart health. So doctor, you mentioned something before we go on the break, which is the DASH diet.
Yes.
Can you, doctor, tell us what is it exactly and how can we keep it up with it?
Sure. It focuses on around like 4 things, mainly to increase the fiber intake. Fiber usually is found in fruit and vegetables.
Yeah.
So people need to focus on having at least 3 to 4 servings of fruits and 3 to 4 servings of vegetables, fresh, of course, fruits and vegetables, so that they have better fiber intake. Then we have the dairy products. It's better that you replace it with no fat or low fat options in order to lessen the amount of saturated fat.
Yeah.
Then also with regard to protein, it's focused on having lean protein, whereby you need to eat more chicken or fish and avoid red meats.
Yeah.
And lastly, it's asked to limit the sodium, whereby it's recommended not to exceed the recommended intake of 2,300 milligram of sodium per day.
Because exceeding this milligrams of sodium will be harmful?
Yeah, overall it does play a role in having a negative aspect on the heart health. Usually people think that we need to stop adding the salt, or to go for, if they drink like bottled water, to go for low sodium water. But these sources actually are not the highest. It's more into having to avoid fast food, because some actually fast food like sandwich and the French fries would cover even more than the recommended intake. And then also canned food usually have high sodium alongside pickles. There is also the ready-made sauces, which usually you find in grocery stores, usually,
So,
for the pasta or...
What does the sodium do? Does it true that it holds the fat on the body, it doesn't make it go out? This is the rumor that we'll hear.
You mean it does cause the fat to go up, or what you said?
It causes the body that not to burn fat and not to burn the liquids on the body.
Usually you might mean for some people with some people who do exercise don't see results when they consume high salt.
Yeah.
Okay. It doesn't have necessarily to do with the fat itself, but usually high sodium intake cause water retention, whereby you will have the water trapped inside your body. So it's not always recommended to have high amount of sodium.
Okay. One last question about the sodium. Does tomatoes has a lot of sodiums?
No.
Okay.
She's innocent.
She's innocent.
Or
She's one innocent red lady. Okay. One innocent red tomatoes. Because tomatoes, a lot of people not been taking it, not been consuming it. They think it has a lot of sodium. She's innocent.
I still receive questions like on, I would say, maybe daily basis about that. But no, it does have actually a good amount of potassium, and potassium usually works opposite the sodium, in which it does help to excrete the extra water inside our body.
Okay. Continuing at the topic, which is the heart health, you mentioned that the DASH diet, and you mentioned the dietary plan about the DASH diet. But is it recommended for everyone, or for a specific type of people?
It's actually a plan in which people who would like to decrease the risk of having heart disease, they can follow. alongside people who actually does have heart disease, they can also follow it.
Okay, so it is good. Okay, but doctor, if I want to follow up to the DASH diet, okay, if I don't, uh, is there any recommended diets except the DASH diet for the heart health? If I'm avoiding, if I'm avoiding, trying to avoid any, any unhealthy plans for the heart, okay, I go and exercise. But I tend to eat, I love to eat some fries and I love to eat some fast food. Is there anything that I can make up to it so I can, minimize the risk for a heart disease or for a heart?
All right. Overall, it's always good to look for alternatives whereby you don't really need to forbid yourself from like food that you like, but prepare or look for alternatives. Now, you'll find in the market many like healthy versions of burger or say like breaded chicken, or even you can prepare it at home in a healthy way. And now many people tend to like use air fryers instead of the deep frying old.
You recommend it, doctor, right?
Overall, yeah, there is no harm in using the air fryer.
They say it's push up hot air, so with it bacteria. I think bacteria dies with the heat.
Overall, you need of course to ensure the hygiene of your kitchen. But other than that, no, it doesn't really have any harm.
Yeah. So keeping up with it, I think it's one of the most important thing. And as we are following to the heart health with the heart disease, we need to focus at what we should eat and what we should not. So is there any other than the DASH diet good for the heart health, let's say for elders?
You can still use it because, I mean, for people who are at old ages, they tend to have risk, increased risk for some diseases, including the heart disease or the high blood pressure. So it's always good to recommend it because at the end it's a healthy plan. It's a healthy diet whereby you need to focus on fiber, like lean meats, to have also like less saturated fat. So it's a healthy diet.
Okay, but we can eat carb with the DASH diet, right?
We can, yes. Overall, focus on like whole grain.
The whole grain, yeah.
So brown, simply bread or rice or pasta instead of the white one.
Okay, thank you, doctor. It was really amazing. Do you have a last like advice for our viewers before we finish the episode?
Just hopefully they can implement some of the advices we stressed on for the diet. And also to stay active, to have a good health for their hearts.
Amazing. And of course, keep up with the dietitian is actually important. And one of the most important things for every person to have a dietitian so they can ask any types of question and to have the knowledge from a specialized person. And Dr. Alsarraf, you are doing an amazing job with us. So thank you for everything.
Most welcome.
And thank you all the viewers for watching. We would see you for the next time. Stay safe and goodbye for now.